When most people drink, alcohol spends time in the stomach before it moves into the small intestine. During that time, stomach enzymes break some of it down before it ever reaches the bloodstream. That process slows the rise of your blood alcohol and stretches it out over roughly 25 to 30 minutes to reach its peak. Roux-en-Y gastric bypass reroutes food and drink past most of the stomach and drops it directly into the small intestine. The small intestine absorbs alcohol very rapidly, and those stomach enzymes that normally blunt the effect are largely skipped. The result is that your blood alcohol can peak at roughly double the level of your pre-surgery self, and that peak arrives in roughly 9 to 15 minutes instead of the usual 25 to 30. Sleeve gastrectomy works differently, but research shows a similar direction of effect, just somewhat less pronounced. These changes are lasting. If you had 1 or 2 drinks and then drove shortly after, your BAC may have still been climbing rapidly while you were behind the wheel, and may have peaked after you were already pulled over. The state uses a calculation called retrograde extrapolation to work backward from the time of the blood or breath test to estimate your BAC at the time of driving. That math assumes a normal absorption curve. For someone with gastric bypass, that assumption does not fit the actual physiology, and that creates a real question about the reliability of the state's BAC number. Many people who have had bariatric surgery experience acid reflux or dumping syndrome. Reflux can push alcohol from the stomach up into the mouth and esophagus, and a breath machine can read that mouth alcohol as if it came from deep lung air, inflating the result. Dumping syndrome and reactive hypoglycemia can also cause sweating, dizziness, and weakness that look a lot like impairment on a field sobriety test. These are documented physiological effects, not excuses, and they are relevant to how the evidence is evaluated. Being honest about this matters. Gastric bypass does not make alcohol safer to drink. It makes alcohol hit harder and faster. The prosecution can use that same physiology to argue you were more impaired than a typical driver, not less. This is not an automatic defense, and results vary from case to case. What it does is raise a legitimate scientific question about whether the BAC number the state is relying on accurately reflects your BAC at the time of driving. That question deserves a careful look by someone who understands both the science and California DUI law. If weight loss surgery is part of your DUI situation, the science behind it is worth understanding and worth raising with a lawyer who knows how to present it. I'm Joel Brand, a California DUI lawyer. This is general information, not legal advice. If you want a free written case analysis, it is at DUI.guru.